Snapshots podcast, hosted and run by the Global Health Working Group as part of the British International Studies Association. This podcast gathers the personal insights and interests of global health researchers through conversations with those at this cutting edge. My name is Christopher Long, co-convenor of the BESA Global Health Working Group, Leverhulme Early Career Fellow at the University of Sussex, and the host and production manager of this podcast. This episode, we're speaking with Simon Rushton, Professor of International Politics at the University of Sheffield. So welcome, Simon, to the Snapshots podcast.
Thanks, Chris. It's nice to be with you.
It's great to have you on. So to begin with then, how did you begin to work in the issue of global health?
Quite accidentally, to be honest with you, Chris. I mean, I came from a background, I suppose, a fairly traditional training in international relations and especially in security studies. Been interested during my PhD in issues around post-conflict peace building, and that was the focus of my PhD, in particular looking at the United Nations role in post-conflict peace building. And then after that, I kind of fell into thinking about health, which is something that I hadn't worked on at all up to that point, and got involved in a project with Colin McInnes and others looking at the role of the health system and the health sector in post-conflict peace building. And that kind of got me interested in global health for the first time. It had never been part of my previous training or even something I really thought about as an international relations or security issue up until that point. But that really kind of got me hooked into thinking about the relationship, I suppose, between health and security and international relations. And then from that project, I worked on, again, quite a lot with Colin McInnes on issues more broadly, I suppose, about those links between health and security, and looking at the ways that was being dealt with in the United Nations. So this was the time which there was quite a lot of interest in the UN Security Council, for example, on HIV in particular, and then on other pandemics. So it was something that I just kind of came into almost by accident, but then actually found so much of interest around that relationship between health and IR that it was kind of surprising to me looking back that I'd never thought about it before, but I just never had. And I don't think, actually, to be fair to myself, many people in the discipline had. There were a few people at that point working in this area, but it was still very much a kind of marginal area of international relations.
Yeah, that's really fascinating. I think speaking to other people we've had earlier on the podcast, the turning point with HIV and AIDS and some of the key kind of disease outbreaks was a real stimulation for people to join the field and kind of analyze like global health and security from more traditional backgrounds. So what have been some of the most important issues and questions that you've kind of investigated in your emergence into the field of global health?
Yeah, I suppose the kinds of work I've done have been changing over time a little bit. And as I've already mentioned, I did, a kind of strand of work, I suppose, around HIV and security, and then later around, I suppose, the concept of global health security and thinking about the relationship between disease emergencies and security, and particularly, I suppose, the kind of thread that linked all that together. And I wasn't alone in this. Other people from IR were doing the same thing at similar times, was really thinking about the pros and cons of thinking about these health issues as security problems rather than just as health problems. So what do we gain from doing that? Potentially in terms of visibility and resources and so on, but also what are some of the downsides of doing that? And I think that's what linked all of that work together. In more recent years, I suppose I've deliberately kind of changed the type of work I am doing. Still very much, I suppose, in what I would call global health, but it's perhaps kind of less explicitly coming at it from an international relations direction, and has become something much more country level, and below that even much more local level. And this is, I suppose, one of the challenges I've been trying to think about in recent years is how do we link up that experience at the local level, kind of everyday experiences of health and of healthcare, and how do we link that up with what's happening at the international level? And I've been doing that through some work that's ongoing in Nepal and in other places. But I think that's really the thing that I've developed over the last few years, has been perhaps doing less at that kind of global level, traditional international relations kind of level, and trying to actually work more from the bottom up and start thinking about what's happening at the community level, and then what are the ways in which we can connect that back with the global in a more explicit way.
Yeah, that's really interesting. What has there been any key driver or question or issue that has kind of led to this shift to the local? And
I think the key driver was really about, I suppose, my own kind of frustration that I think, international relations gives us tools for answering certain kinds of questions, and they're important kinds of questions. I don't want to kind of downplay that, but they're very often kinds of questions that are very remote from the everyday experiences of people wherever they may be in the world. So I think there's important work to do looking at what's happening on that kind of diplomatic level in Geneva and New York and so on. And I certainly don't want to downplay the importance of that, but it felt to me, I think, increasingly remote from those everyday experiences. And I think that's inevitable in a discipline like international relations. This is, I suppose, the kind of traditional divide we've had between international relations on the one hand and domestic politics on the other. But it's one that I suppose I increasingly found constraining for trying to understand what's happening in the world, and I suppose in the end how that might be improved.
Yeah, that's really interesting. Do you think the issue of global health gives you a particularly powerful way to cross that divide into the local?
Yeah, I do. I do think that that's a really good point, actually, Chris. I do think that, and I think that's because it is such a universal issue, right? Whoever you are, wherever you are, first of all, there are a whole series of things that determine your health and determine your health outcomes. Thinking about the social and economic determinants of health, that's true whether you're rich or poor, wherever in the world you live. And then, when things do go wrong with your health, then equally that need for healthcare services is also universal. So I think that does give you a really good way in, I suppose, to thinking about issues of inequality more broadly. But the other thing I would say is that both that determinants of health and whether or not you have access to health services when you need them, they're just inherently political issues, right? And I think that is why we can connect this back up with thinking about politics and international relations. There is nothing more political than your health, but this is really, I think, something that we need to look at all levels. And one of the problems with the ways in which academic disciplines are constructed, I suppose, is we have these artificial boundaries between things, and international relations has set itself up for the whole history of the discipline as thinking globally, and I think that's important. But it's important also, I think, that we think locally too.
Building on your comments of the global health as a really interesting way into the local, where you say, everyone has a need for health resources, right? But there's always a limited amount of resources, right? Which then brings that political question in. That seems, really interesting and fascinating. Have you found in your work, as it's kind of emerged, has your work revealed any kind of preconceived myths or disconnects?
I think one of the things that I've really learned during this work is about how different disciplines see the world, right? And I think this is something that, as I've increasingly collaborated with people from different disciplines, whether they be medics or from public health or medical anthropologists or medical sociologists and health economists, all of these disciplines have such hugely different ways of thinking about the same problems. And I think that's been one of the things that I didn't know, right? When I started out on this journey, you tend to be trained in a single discipline and assume that other people think in similar ways. But it's not just about methods. It's about the kinds of questions that you think are relevant and important. It's about the kinds of theoretical and conceptual approaches that you bring with you. And I think this is something working across disciplines, which is really difficult to achieve. And I'm not claiming I have achieved it in a perfect way, but I think I found that really important to work across those different disciplines, because it pushes you to think in ways that your own comfort zone of a discipline maybe wouldn't lead you. to think in, and to ask different kinds of questions in different ways. So that's been one of the I suppose the kind of key things for me on this journey of learning about global health, has really been to try and think about problems from those different perspectives, or at least understand how they are thought about from those different perspectives, and what does that bring, and what can mixing those different disciplinary perspectives do to the ways in which we think about problems. So I suppose that's been one of the things that's been kind of challenging for me, but challenging in a productive way, I guess.
Yeah, that's really interesting. Yeah, so working across interdisciplinary reveals some kind of fundamental disconnects as to how different areas perceive and understand their subject matter. Yeah,
that's right. And all disciplines have their blind spots, right? All disciplines have things that they're interested in, and things that they bracket out. And that's very often based on disciplinary histories or dominant theories or concepts or particular kind of methodological approaches, much more than it is about the real world and about how problems manifest and can be dealt with in the real world.
Yeah, definitely. Has there been any big surprises, or can you think of one big surprise when maybe you were starting out and you thought that something was one way, and then maybe your research led you to to quite a revelation? Or
I think one of the things that always really strikes me, coming from an international relations background, is actually the complexity of those dynamics between the international and the local, right? And I think international relations often tends to lead us to think about things as being fairly kind of unidirectional, right? And to an extent, this is true, right? Agendas are often set by big, powerful states in the international system, and then the international system does things to poorer, weaker states, and on down the chain, And I think international relations is very often led us to think in that way, but actually things are much more complex. And I think this isn't certainly not a new observation by me. There are many other colleagues who've been working and thinking about these kinds of things, but agency is much more distributed in global health than that traditional international relations perspective might lead you to think. And thinking, for example, of the work that the people like Emma Anderson and Amy Patterson have been doing on African agency, Sophie Harmon, working, this is very much, this is not a one-way street. We get really interesting forms, not even at the national level, but even at local level, of adaptation to, resistance to those international programs, or co-option of for local political ends. So it really is a very complex relationship between the local, the national, and the global. And its power doesn't always flow one way, and can be utilized by different actors in different positions for their own purposes.
Yeah, that's really interesting. Yeah, the way you mentioned, the challenge that the more local perspectives presents to the top down, maybe more traditional IR theories or perspectives.
And that's not unique in global health. If you think about the literature on norm localization and all of those kinds of things, these are kind of quite well known dynamics in global politics more broadly, I think. But I think you do very, very clearly see them in global health.
Yeah. I guess with regards to theories, have you found any particular theories really interesting and powerful in your work and in analysing the issues of global health?
Yeah, but I suppose different things for different kinds of questions. And so a couple of things to say about this. I mean, some of that more global level work I've done has tended to be based, in a kind of fairly standard way, I guess, around using constructivist IR theory to try to understand the ways in which norms are built and so on. But I found that not useless, but having much less traction, I think, when I've been working at the local level, where that kind of theoretical or conceptual toolkit doesn't always really help you explain. And I think there are two things that I would say here, I suppose. One is, actually, I've often found working in that more local level that being empirically rather than theoretically driven can be more satisfying, right? And actually part of that for me is part of the attraction of working at that local level. It's about getting to try and understand how things work in a place more deeply, and that starts off at least being an empirical question. And then I suppose trying to think, okay, so what are the concepts and the theoretical tools that might try and help us understand this? So in a way, I find myself working almost in the opposite direction. Rather than approaching a problem from a particular theoretical perspective, actually just trying to learn as much as I can about the empirics of a problem, and then thinking afterwards, and not always successfully, because this is really hard, actually, what are the kinds of conceptual and theoretical tools that might help us? So it's I find it a very different process and a very different way of thinking, I think.
Yeah, that's really interesting. And I guess you have more empirically rich data that leads you to different conclusions than maybe starting off with a framework and trying to either fit stuff or adapt it to the empirical data that you have or that you find.
Exactly. That's exactly right. Yeah.
I guess as you move forward with your research, what are the kind of the key high priority issues or questions that you're kind of taking forward and looking to investigate?
I think one of the big, I mean, this is not, I suppose, an answer which is about a particular research question, but is more generally about the field. You know, I think we do still have a lot of thinking to do as a field about the ways in which we engage with global health as a kind of field of study. And it's, you know, the whole idea of global health is of course one that is to a great extent kind of constructed through particular disciplinary lenses. And I think very often when people talk about global health, and this is not just in international relations, in many disciplines, you know, what they're actually talking about is health in poor countries. And I think there is still that problem, and I'm not free of this. I suppose I'm aware of it as a problem at least, but I'm certainly not free of this. There is still that problem of a kind of colonial mindset in many parts of the discipline. And for me, that is the big challenge going forward is how do we change that? How do we do research in equal and respectful ways alongside people, not only from the countries that we're researching, but also from the communities that we're researching? And that's what's led me, I suppose, to much more use, for example, of participatory research methods, of co-researching with people from communities, trying at least, however imperfectly, to challenge some of those power hierarchies, right? And it's not easy to do, but how can we change the ways in which we do research, not just in terms of data collection, but also thinking about our research agendas and what is it that needs to be done, and what kinds of questions do people think are the important ones to be asked? And then in a kind of participatory action research way, I suppose, what are the kinds of things that we as outsiders with certain sets of skills and knowledge can bring to help them answer those questions? And I think that for me is the real challenge for us, is how can we can never completely upend those power hierarchies, or at least it will take a very long time to do so, but how can we try to mitigate their effects? I suppose, how can we try to make sure that those power hierarchies at least are being used in the service of things that people who are too often on the receiving end of those things actually want, right? And things that they value, things that they think are worth further research and thinking through. So that for me, I suppose, in my own work is kind of how I'm moving forward, is trying to think about, sure, I bring a kind of training and I bring a certain set of methodological or conceptual tools, but how can we use those in ways that are avoiding, I suppose, some of the worst pitfalls of that more top-down, global north driven, potentially neo-colonial work?
Yeah, that's really, really interesting. I think really important questions for the discipline as a whole, right? As we kind of begin to more reflect upon, the colonial origins of a lot of research and the way that certain section of the world interact with others. I think it's really important, interesting questions to look at as we move forward. I guess, do you have any advice for those early scholars working in global health, or those people who are interested in studying global health, and any advice for them as they begin their careers?
Yeah, well, I suppose the advice, and this is the kind of logic, I suppose, of what I've been saying in answer to the last few questions, is try and break down those disciplinary barriers. Read beyond your disciplines, talk to people from beyond your discipline, really try to think about whatever the empirical issues you're interested in are from a wide variety of disciplinary perspectives. And that's something that I kind of came to late. And I think very often people at the starts of their careers do come to those late, because the whole way we're trained is usually within disciplines. And I think, disciplines have their advantages in terms of ordering and structuring knowledge and so on, but they have their disadvantages too. So I think it's really about trying to push yourself to not abandon your disciplinary origins, but actually try to see the world in other ways as well. And I think that's something that the earlier you do that, the better, because it means you can become much more fluent in those different disciplines than I've been able to be, and coming at that relatively late.
That's fascinating and great advice. That's really interesting and fascinating insights, Simon. So I think we'll draw the podcast to a close there, and thank you very much for taking part.
It's a pleasure. Thanks, Chris.
Thank you. Thank you for joining us for this episode of the Snapshots podcast. Please see the show notes for more information on our guest.